oxidative stress, other things on board. There's preservatives in the vitamin K that they give the baby. So there's a lot of things going on that the baby's body has to deal with that in a natural environment they wouldn't have to deal with.
Yeah. And apparently there's also an association between the levels of acetaminophen in the mother's cord blood and autism spectrum. Is that true?
Yeah, so that's a huge. If you just divide women into 3 groups based on how much acetaminophen was present at the time of birth, and the ratios of autism are 1, 2.2, and 3.6, remember, just dividing them into 3 groups.
Just what is it, like low acetaminophen, high acetaminophen, and none?
No, low, medium, and high, because it's present. It's basically an everywhere chemical.
Okay,
now.
Yeah.
And your body can even make it from some microbial metabolites. So it's present in tiny amounts in everybody, depending on your analytical technique. But then, they've just taken it. And there's been studied, the correlations between the analytical chemistry and what the mothers report is pretty good. But this study that we're talking about in cord blood, that's actual analytical chemistry. They just divide them in 3 groups. So if you run those calculations, so you got assume the bottom third of 1.0 is sort of normal, and then the middle range 2.2, and then 3.6. You just run the arithmetic, say, wow, about half of all autism could be just from the acetaminophen. And that is the worst time. If you, throughout your whole life, from conception probably until death, the worst time in your life to be exposed to acetaminophen would be right when they clamp that umbilical cord. Because that's when your liver's capacity to deal with that molecule is at its absolute lowest, because as soon as you're born, it's going to start getting better and better and better over the next few years.
Wow. So the oxidative metabolism of acetaminophen produces NAPQI, which can cause damage. And it's going to cause damage in proportion to how much is created through that metabolic pathway and in proportion to what your natural antioxidant capacity is. So the more you produce, the more damage is going to be done. The lower your antioxidant capacity, the more damage is going to be done. And then I would assume also, just in parallel, the amount of oxidative stress you're under at the time that you're exposed to acetaminophen and you metabolize it that way, that's just going to leave you even maybe more prone to damage, because if something is causing just oxidative stress, generally speaking, and then on top of that, you got this NAPQI metabolite, that's just more. So what are the major events in early life that might induce oxidative stress in a young baby?
Well, of course, a lot of that is a lot of the susceptibility or the events. A lot of it's genetic, right? So it's the same with codeine, right? I mean, the 100% of codeine, that was just a certain one of those cytochromes, one of those oxidative cytochromes. If it's working too well, then you get an overdose of morphine. So it's the same deal with a lot of it is genetic. But say if you talk about an event.
What about let's call it an immune event? If your immune system was, say, stimulated, is that going to lead to oxidative stress?
Well, if it's stimulated by, say, an infection, yeah, that's going to lead to, and of course, a vaccination stimulates the immune system. A lot of babies with jaundice means that there's something going on. You're having problems already with your metabolic capacity, and that's associated with autism.
So if something triggers your immune system, there's going to be some oxidative stress that comes with that. And that would also be, let's say it gives you a fever. That would be exactly when a parent might be most likely to give the child something like Tylenol.
Right, exactly. Yeah.